This chart shows the number of COVID-19 patients isolated in Lee Health hospitals every day for the last 3 months. Now, we peaked in January with more than 200 being treated, and you can see how we've steadily declined every day since. Well, today we're at about 58 patients, and that is the lowest number of patients we've seen in more than 4.5 months, a 71% decrease from our January peak. You just saw the winter wave. Now let's rewind to the summer surge. Look at this. Things were drastically different then than they are now. Our peak over the summer saw more than 300 COVID patients in Lee Health hospitals.
Keep in mind, during this time over the summer, the virus was newer. We knew a lot less about it than we do now. There was no vaccine, and doctors were just starting to have some treatments. Our hospitals were pushed to the limit. I got some perspective on how challenging this past year has been for our healthcare workers in a conversation with the CEO of Lee Health, Dr. Larry Antonucci. What do you remember about the very beginning and hearing from your doctors that COVID is here in Lee County?
I got the call that evening, and I had no idea what we were about to face. We knew that, yes, this was going to be a pandemic, that we would see cases, but I never had any idea of how severe it was going to be and the things that we would have to do to get through this pandemic. It was something that you couldn't imagine, or really couldn't even prepare for in your wildest dreams.
You couldn't grasp then how big this was going to become?
Exactly. We knew it was coming. We knew we would have cases. But what was impossible to really grasp is what the year would look like.
A year, Dr. Antonucci says, like no other. Hospitals full of people sick with something they weren't exactly sure how to treat. They were suffering. They were isolated from their families. And the doctors, nurses, and all the other medical staff working with them were putting their own lives at risk to try and save them.
It gave us a real dose of humility. We're used to being able to take care of things and knowing what to do. Whether you come in with a gunshot wound, a stroke, or a heart attack, we have it down. We know what to do, and we know what to do to get you better. Here we were dealing with a disease that we knew almost nothing about, and we were learning on the fly, and it really brought back that art of medicine to say, okay, here's what we're going to do, here's what this looks like, we're going to try this, we're going to see if it works, we're going to learn from others from around the world. And it was a constant state of learning and innovation.
Looking back over the past year, what was the low point? What was the most challenging moment that had you almost feeling defeated?
I think the most challenging time was in July.
The summer surge.
The summer surge, where we hit over 360 patients in the hospital. This is a time of year where we may have a total of 1,000 patients in the system. And we were carrying over 1,400, and 360 of those had COVID. That was a scary time. The patients were really sick, and they needed ICU care. And sometimes we had to set up other units as ICUs.
And so here we are, full circle after a year. Fair to say this was the greatest challenge of your career?
Without a doubt, this has been the greatest challenge of my career, and I would suspect for almost everyone working in the health system. This is something that we never anticipated, that we didn't even think about, as in our day-to-day work.
He credits members of his medical staff, some of whom lost their own loved ones to this disease, for showing up day after exhausting day to help strangers in their time of need.
The entire community went through this. We lost over 600 people to COVID, and every one of those had a family and had loved ones, and it just really inspires me to think about what we all went through this past year.
As devastating as the pandemic has been in Florida, Dr. Antonucci says there were two things that likely prevented more deaths in our state. One is that our big summer surge came a few months into the pandemic, so by then doctors had better treatments and understanding of the virus. And our climate. It's easier to stay outdoors where the virus is less likely to spread.
coming to you from my little hometown up in Northeast Ohio, and I'm still here, unfortunately, because at some point in my travels between Fort Myers, Naples, and Cleveland, I contracted COVID-19.
Hey guys, Peter Bush here. I started rocking a mustache during quarantine. At first, I wasn't so sure, but then it really started to grow on me.
Not. We all remember that so well last summer when both Peter and Rob got sick with COVID. And I'll be honest, sitting here at the desk, I was really worried about both of you at the time.
Oh, thanks. Well, we each had to spend weeks in isolation, and I mean, like so many of you, despite the dad jokes, just to keep myself from going crazy, we felt the scary impact of having the virus. Fortunately, neither of us had to go to the hospital, but I don't know about you, Rob, but I will never, ever forget those 3
Rob,
weeks.
you were 40 days before you could come back to work, correct?
I was pretty miserable for a few weeks of that. It wasn't a good experience at all, but we certainly are very lucky compared to what so many people in our community have had to deal with.
Absolutely.
So, let's move on, because I don't want to really...
It's a beautiful day, so let's lift people up and look outside.
When I was up in Ohio, sick as a dog, I was thinking about these views here. So
Yes.
why don't we soak them in here together as we take a live perspective over top of the Diamond Head Resort together. It is going to be a beautiful night for you tonight. You've got comfortable temperatures, low humidity, numbers right now in the low to mid 70s. So do something fun outdoors in the backyard or something with the family tonight, because the weather is just kind of unbeatable. Weekend's a different story, though, I'm afraid. There's a storm system coming our direction. It's going to give us some clouds and some rain tomorrow, and then give us nicer weather on Sunday, yes, but also help to really ramp up the breeze as this weather system pulls away from us for the second half of the weekend. So here's how things play out for you on Saturday. First half of the day is quiet. The weather system's too far to the west of us to do much to us on Saturday morning, but once we get past lunchtime, that's when the doors open up for some rain. And keep in mind that it's probably not going to rain every single minute of the afternoon and the evening, but we certainly have a very good opportunity for some beneficial rainfall as you move through Saturday afternoon and Saturday evening. Rain amounts may be pretty respectable for dry season standards, as a lot of us may end up with more than a quarter inch worth of rain here as we get toward the first half of the weekend. I mentioned before, though, on Sunday, the winds pick up behind this thing, but the skies clear out. So a breezy go of things on Sunday, but with lots of sunshine as well. Nice weather for you in the rest of the 7-day forecast. Mid-70s on Monday and Tuesday, back to the 80s on Wednesday and Thursday.
We're still here.
Sean Martinelli looks towards his grandparents for perspective during the pandemic. It is tonight's story to share next.